Lyme starts off as a non-specific flu-like thing, like a virus. You don't feel good, you have a headache, maybe your eyes hurt, and you're tired. If it's not treated and it's persisting, then it seems to change over time. That original stuff does not go away, but more things start happening. You start to get individual systems involved. It starts to maybe be joints, maybe the nervous system, maybe other parts. And then what it does is it starts to skip from one place to another. For example, you can have a swollen, painful knee for a number of weeks to months that gradually goes away on its own. Remember, Dr. Steer thought it was self-limited. But then what happens? It pops up somewhere else. It could be a sore hip or a bad wrist or something else. Then that'll seem to go away. And then a Bell's palsy comes and then it goes away. So the hallmarks of Lyme is that it's a multi-system illness, that it migrates, it moves around, and it comes and goes in cycles. In fact, Borrelia, this class of germ that we call Lyme, they belong to a family of germs that are called relapsing fever germs, that they know the germs come and go in a cycle. Cycle for Lyme disease is 4 weeks. So if you have a patient keep a daily diary, which I always recommend, you're going to find that there are good and bad days, good and bad weeks. And if you map it out, it follows a 4-week cycle. So again, it's multi-system, it migrates, and it comes and goes in cycles. The other thing to know about is that other forms of arthritis, like rheumatoid, are not migratory. They stay in the knee, and that's where they go. They go in the fingers, and that's it. Same thing with nerve damage, neuropathy. A fixed neuropathy, like with diabetes or toxin exposure, is in one part of the body, whereas Lyme disease waxes and wanes and comes and goes. And it's one of the very rare few things that causes a migratory neuropathy. So those are the hallmarks of the clinical diagnosis. Now, if you get a blood test and it confirms it, great. You get a blood test like an ELISA, which is poorly sensitive, and it doesn't confirm it. The blood test doesn't make the diagnosis. The patient makes the diagnosis, the history, what you see in front of your eyes.